Okay, so I am here to reflect a little bit about our standardized patient encounter this weekend. Overall, I felt really good about the information I got from the patient-based outcome that I handed out, which was the Oswestry Low Back Scale. I did actually already ask a few of the questions that he addressed on the questionnaire before I handed it to him. And I think that I will continue to use these patient-based outcomes, but I don't think I'll ever choose for that to be the first thing that I do. I can't imagine walking into an evaluation and just handing you a piece of paper and sitting quietly, because there was some amount of silence, but I think it was good to prompt a conversation, get a little bit of information before you just use a questionnaire. It did actually open up a little bit of information he didn't previously give me. So originally he was talking a lot about his want to run again because he's not able to do any physical exercise right now. However, on the Oswestry, he rated that his injury was pretty severely impacting his social life. So I kind of asked a little bit further into that, and it was a lot about his interaction with his wife, not being able to go grocery shopping or garden or do whatever it was around the house. So it was affecting pretty severely his relationship with his wife, and even farther into the evaluation when he was setting goals for himself, that turned out to be one of the top 3 goals, was how this was affecting his relationship with his wife. I don't quite feel confident in the whole body approach yet. So what happened in this practical, what it kind of pointed out about myself, is that my previous subjective evaluations were often probably a little too structured. So if I had a knee patient, I was asking how it felt when you go upstairs, or does it hurt more at night? Do you hear popping? And all of those questions were this question, this question, this question, because my mind was, okay, now we can probably rule out this pathology. Now we're going to do this special test. It was all intentionally leading me to what I was going to do in my evaluation, rather than how this injury was affecting this particular patient individually. I think my patient responded really well. We were making a lot of eye contact. He was very open with me. Like I said, he kind of prompted the more emotional aspect, feeling a little depressed and frustrations about this injury before I really had to specifically ask that question. And I think that the Oswestry and just in general asking about his personal life kind of led him there. Now, my concern is that I'm not going to get that easy of a response about that more emotional aspect of injury from adolescents. So I think it's going to be interesting for me to attempt to find a scale that adolescents are comfortable with, and then also find an environment and build how long into treatment am I going to have to build trust before I can start to ask those questions with adolescents. Do I need to take these all into a very private room? What exactly kind of questions do I need to ask in order to gain that from my athletes? Because in my experience, even in the PT clinic, that geriatric and just a little older population are often very open about that, have no issue talking about it. You don't even have to specifically ask, they're going to tell you. So overall, I think it really enhanced my learning experience. Like I said, I'm really going to have to practice being able to speak to them very compassionately, be very invested in their responses, and then be able to switch to clinician, because right now I felt a little disorganized when I did that. And in my previous practicals, I think that I talked more and asked question than I did in this particular standardized patient, which was good, but like I said, it kind of left me a little disorganized in my brain. So that's going to take some practice. He also threw me for a curveball when he said, "Is this the only time you're going to move me?" So he was sitting when I got there, and all I did was have him lean back onto the table, and he specifically said he didn't want to move again. So that eliminated a lot of what I was planning on doing. And so I don't know if that was the correct approach in saying, okay, I won't move you again, and completely adjust my eval, or tell him, I really think if we put you in this position and I tested this, it's really going to help me eliminate or lead me to a diagnosis or away from one. Kind of explain that. I really have no idea what was the correct approach. But overall, I'm very interested in seeing how I can implement this into my daily clinical practice.